Shock. Shock is a life-threatening condition which occurs when the circulatory system fails to deliver oxygen and nutrients to the body tissues and becomes unable to remove waste products from the body. It is a descriptive term based on the symptoms and signs secondary to one or more of wide range of problems. If not recognized and corrected as early as possible, shock may rapidly progress to an irreversible state with subsequent multi-organ failure and death. Now, definition of the shock. Shock is defined as pathological state causing inadequate oxygen delivery to the peripheral tissues and resulting in lactic acidosis, cellular hypoxia, and description of normal metabolical conditions. Now, classification. Shock is generally classified into three major categories. Number one, hypovolemic shock. Number two, cardiogenic shock. And number three, distributive shock. Distributive shock is further subdivided into three subgroups. Number one, septic shock. Number two, neurogenic shock. Number three, anaphylactic shock. Now, hypovolemic shock. Hypovolemic shock is present when marked reduction in oxygen delivery result from diminished cardiac output secondary to inadequate vascular volume. In general, it results from loss of fluid from circulatory either directly or indirectly. Example, hemorrhage, loss of plasma due to burns, loss of water and electrolytes in the area. Third, space loss means internal fluid shift into inflammatory exudates in the peritoneum, such as in pancreatitis. Next one is cardiogenic shock. Cardiogenic shock is present when there is severe reduction in oxygen delivery secondary to impaired cardiac function. Usually, it is due to myocardial infarction or pericardial tamponade. Cardiac tamponade is the life-threatening medical emergency where fluid rapidly accumulates in the sac surrounding the heart, that is pericardium. Next one is septic shock. Septic shock or vasogenic shock develops as a result of systemic effect of infection. It is a result of an septicemia with endotoxin and exotoxin released by gram-negative and gram-positive bacteria. Despite normal or increased cardiac output and oxygen delivery, cellular oxygen consumption is less than normal due to impaired extraction as a result of impaired metabolism. Next one is neurogenic shock. Neurogenic shock results primarily from the disruption of the sympathetic nervous system, which may be due to pain or loss of sympathetic tone, as in spinal cord injuries. Pathophysiology of shock. Shock stimulates physiological response. This circulatory response to hypotension is to conserve perfusion to the vital organs like heart and brain at the expense of other tissues. Progressive vasoconstriction of skin, splanchnic and renal vessels leads to renal corticalcinocrosis and acute renal failure. If not corrected in time, shock leads to organ failure, and sets up a vicious circle with hypoxia and acidosis. Now, clinical features of shock. The clinical presentation varies according to the cause, but in general, patient with hypotension and reduced tissue perfusion present with tachycardia, feeble pulse, narrow pulse, cold extremities, sweating, anxiety, breathlessness, and hyperventilation, confusion leading to unconscious states. Clinical features of hypovolemic shock in adults with estimated volume loss. Estimated blood loss 750 to 1500 ml, 1500 ml to 2000 ml or more than 2000 ml. Blood pressure normal, reduced, severely reduced pulse rate if more than 100 minutes or more than 120 minutes, more than 140 minutes, very feeble. Capillary refill, slow undetectable. Respiratory rate 20 to 30, 30 to 40, more than 35. Urinary flow rate normal 30 to 60 ml per hour or 0.5 to 1 ml per kg per hour. 20 to 30 per hour, 10 to 20 per hour, 0 to 10 per hour. Mental state: anxious, confused, lethargic, comatose. Now management. The treatment is aimed at restoring oxygen delivery to the cells of vital organs as rapidly as possible. The management depends on the cause, type of shock. Management of shock. General management: monitor airway, breathing and circulation as first priority. Stop bleeding. Fluid resuscitation, preferably crystalloids. Head down position. Treat the cause. Transfusion of complete blood if indicated. Oxygen and other supportive measures like inotropic agents. Monitoring of resuscitation effectiveness. Example: determine hourly urine output, blood pressure and pulse rate. Specific management. Hypovolemic shock. The goal of treatment is restore vascular volume. This affects by general approach as above: fluid and blood replacement, oxygen support, etc. Management of septic shock. Initial management as above: appropriate antibiotics, especially for gram-negative microorganisms. Inotropic support such as adrenaline and dopamine. Surgical eradication of the infection focus. Cardiogenic shock. So initial statement management as above: intropes and treat the causes. Neurogenic shock. Initial management as above: pain relief, treat the cause, give supportive measures like inotropic support. Now, complications of shock. The main complication of severe shock include ARDS, acute respiratory distress syndrome, acute renal failure, gastrointestinal ulcerations, disseminated intravascular clotting, multi-organ failure, death. Therefore, a patient in shock requires immediate emergency treatment. Early diagnosis and immediate correction of shock prevents permanent organ damage and death. Now, homeopathic therapeutics. Homeopathic therapeutics for shock focus on addressing immediate emotional or physical trauma using highly diluted remedies. The remedy selected depends entirely on the root cause, the specific physical or physiological or psychological symptoms the patient exhibits. Aconite, the primary remedy for sudden fright, panic, and intense fear following traumatic experience. Arnica, indicated for physical trauma, bruising, and shock, where the person feels battered and insides they are fine and refuse assistance. Ignitia, often utilized for emotional shock, grief, or mood swings following sudden bad news or loss. Hypercum, known as the arnica of the nerves. This is used when shock accompanied by shooting pains, tilting, or occurs after injury to nerves rich areas like the spine and or fingertips. Carbovis, indicated for states of deep collapse or fainting where the person feels cold, struggles to breathe, and wants to be fanned. Thank you, sir.